Augmentative and Alternative Communication, developed by speech-language pathologist Jennifer Mitchell at the Training and Technical Assistance Center at Old Dominion University. Joint attention, overextension, and intonation are important factors that contribute to language development. When a child is nonverbal or minimally verbal and unable to participate with these components, their development of language can be vitally impaired. One of the earliest questions that a young child learns to ask is, "What's that?" After pointing to an unknown object and asking, the adult will name the object, which will lead the child to increase vocabulary. Children who are nonverbal or minimally verbal are not usually taught to ask questions such as "What's that?" So this skill is not achieved. The consequence of not asking will be smaller vocabulary skills. Young children learn to initiate joint attention by commenting about something they find interesting. Children will complete an art project, then show an adult and wait for a response. This social skill is also important for language and communication development. Once a child has a working vocabulary, they begin to use their words as often as possible. Since their vocabulary is limited, they may incorrectly name categorical items with the same label. For example, after learning dog, the child might point to another animal and say dog. This is overextension. When the child overextends, the adult correctly names the object and will often explain how the two items are different. This process serves to expand vocabulary with new words and explain similarities and differences between the objects. Children who are nonverbal or minimally verbal rarely engage in overextension, so do not easily expand their vocabulary skills. Before learning to ask WH questions, children ask questions by modifying their intonation. For example, verbalizing "all gone" with a rising intonation is asking a question, and if they use a falling intonation, "all gone," it's making a statement. Children who are nonverbal or minimally verbal do not have the option to change their intonation. Nonverbal children and minimally verbal children may have difficulty with joint attention to comment and seek information, difficulty with overextensions, and difficulty using intonation to ask questions. These skills are important for language development. The next module will focus on the three components of language and communication: content, form, and use.